Your question is, what is the difference between embryonic and what we're doing?
Okay.
Embryonic stem cells exist for a very brief few days when a baby is first conceived. After that point, they go on and do their job of transforming and creating the over 220 different cells that make up that baby at the time that they're born. When the baby's born, the stem cells themselves have undergone genetic changes and they become adult stem cells. So at birth and forever, all throughout your life, the stem cells that you have in your body are called adult stem cells. And that's all we do. We collect adult stem cells from newborn babies, older children, and adults. We concentrate them and we save them for medical treatments for that individual or for their family to share. So we have nothing to do with embryonic. In fact, if you look at the 2000 clinical trials that the FDA has approved, there's not a single embryonic stem cell therapy being evaluated. It's all adult stem cells. And the reason is that embryonic stem cells can't be controlled yet. They don't understand how to take cells that were meant to only exist for a brief period of time and put them in an adult and have them respond safely. Right now, they more often than not will go out of control.
Do embryonic cells have any value? Is there any? The embryonic cells are when a child, an abortion. Is that correct?
Well, in order to harvest embryonic stem cells, you necessarily have to harvest them and destroy the egg. And so when you take the cells, that egg is destroyed. And so in some perspective, you've terminated a life that could have gone on and produced a real child. So there's tremendous moral and ethical considerations about using tissue that way, when in fact you can take it from an adult safely and not have to be involved in any of those ethical dilemmas. That's why most of the religious leaders and government leaders have been very supportive of adult stem cell therapy and research, because they feel we haven't even tapped the potential of adult. On the other hand, the scientific community is enthralled with the potential of embryonic, because embryonic stem cells have one characteristic that's unique, and that they can become any cell in the human body. Adult stem cells can become many cells, but not all cells. And so the potential from a scientific point of view is fascinating for embryonic stem cells. But from a medical perspective, there's more immediate benefit to be had from looking at and being treated with adult stem cells. They've already been proven to be safe and to be effective in treating many diseases.
Now let me understand, adult stem cells are actually what you get out of umbilical, out of cord.
Correct.
You're an adult adult stem cell from the time you're born.
Absolutely.
So, great question, and we'll address it if you'll use the question in your answer to say what is the difference between cord blood and adult blood.
The difference between cord blood and adult blood is that cord blood was produced while you were in utero, while you were being formed, and so it's uniquely potent. The cord blood is very concentrated in stem cells, and the stem cells are themselves more naive, and this is good. It means that they have a greater ability to transform into many more cells than the kind of adult stem cells you will produce at 6 months, at a year, at 5 years, and 10 years. And so if you do nothing, collect cord blood for every child that's born, because you're going to get 10 to 15 million stem cells from as little as 75 milliliters of cord blood, and it's the most potent stem cells that that child will ever have.
Great. Sorry, I'm thinking of another one you could explain. So you can use cord blood. Actually, cord stem cells are adult stem cells.
Yeah. The younger that you collect your stem cells, the more potent they are, and the less risk that the stem cells have undergone genetic changes. All of our cells as we age go through a pre-programmed aging process. That can be accelerated by disease, by our lifestyles, by the chemicals we eat, radiation, many things. That's why we encourage our clients to store as young as possible, certainly while they're still healthy. And we find when we measure the number of mononucleated cells, which is the population that stem cells are part of, that the younger you are, the more you have. So this is just a good practice.
Will you explain, Dr. Connie, what they're using? You said earlier, and I wrote it down, about how they've already been using stem cell for patients who have undergone chemotherapy or cancer treatments.
The T cells.
It's a practice that's been quietly going on all over the world, certainly in the United States as well, that after you've had chemo and radiation, if you have access to stem cells or you've stored your own stem cells before you've been treated, you can use them to boost the immune system and recover more quickly from the damage that the chemo and radiation has done to your immune system. We all know that after you've had these treatments, it takes a long time for you to regain your good health and feel strong again. And that's your immune system slowly rebuilding itself. Every time we get sick, even a cold or a bacterial infection, and certainly if you're fighting a serious illness like cancer or other serious diseases, your immune system is active, it's participating, it's pouring stem cells into your bloodstream. After a while, it can become fatigued. And so it's very helpful in your long-term recovery to boost your immune system as much as possible, because after all, that's what saves you over the long term. It's your body taking care of the residual cancer cells or bacterial cells or viral cells doing what it does. We presumably are killing off cancer cells that form all the time, and we never get cancer. We get bacterial infections and never get seriously ill. That's the immune system working properly.